Thank you for trusting Campo Verde Dental Hospital for all of your dental needs. This video will tell you what to expect on your day of surgery. Be sure to follow all of your nurse's instructions prior to coming to hospital. If you suddenly become ill a week or two prior to surgery, it is important to let our staff know, as you may need to be postponed or canceled. The day will start out in our surgical endodontics waiting room, where your family members will wait while you undergo surgery. They will watch your progress on our flat-screen television monitor. A nurse will update you with texts or phone calls while you are in theater. The staff at the front desk will give you some forms. Once all of the paperwork is filled out, will be called back into the surgical center. One of our nurses will measure your height, weight, blood pressure, oxygen, temperature, and other vital signs. They will also ask you questions about allergies or past experiences with procedures or drugs. It is important to answer these questions, as your procedure cannot be done without these mandatory safety checks. You will be given ID bracelets that you will need to wear throughout your visit. A dental radiographer will take you into an X-ray suite where you will have several photographs of your mouth and face taken. The surgeon will refer to these while he is working. The amount of X-rays taken will depend on your procedure and your dentist preferences. These photographs will then be processed and sent to a computer in the operating theater, so that your surgical team can view them during your procedure. You will wait in our dental consult room until your photographs are done being processed. In this consult room, you will meet with your dentist and they will discuss all of the procedures they plan to do and all of the teeth that need these procedures. You may have a cleaning done at this point or a simple exam. You will be asked to rinse with hydrogen peroxide prior to the procedure or surgery. Next, one of our pre-op staff will take you to your own private room. Here you will change into a hospital gown and be connected to monitors that will continuously record your heart rate, blood pressure, and the amount of oxygen in your blood throughout the day. In this room, you will meet all of the members of your dental care team before being taken to theater. Your anesthetist will do a quick physical exam of your upper airway. You will be asked many of the same questions to ensure your safety. Once all the pre-op checks are completed, you will be taken to theater. When it is time to go to theater, you will be covered with a warming blanket, and your monitor will be connected to the side of your bed so you can be wheeled to the theater. The monitor is highly portable and will continue to record your vital signs along the way. Introduce yourself to the surgical team once you arrive in theater. Once in theater, you will be transferred to the bed in the middle of the room, your monitors will be reconnected, and the anesthetist will apply a mask with oxygen onto your nose. A small catheter, a tiny tube, will be gently placed into a vein at the back of your hand so that fluids can be administered during surgery. The ODP or anesthetist will start giving you drugs through the IV to make you go to sleep. Once asleep, a plastic airway will be inserted to assist with breathing and to administer anesthetic drugs. Your procedure will take place after you are asleep and intubated. Dental procedures are carried out using a strict aseptic technique. All sterile team members are gowned, the patient is prepped and draped, and all instruments are laid out on a sterile surface. A large drape will separate the anesthetist from the sterile team. Body functions will be monitored constantly throughout the procedure. Once the surgery is completed, the anesthetist will reverse the anesthesia, remove the breathing tube, and transfer you to the recovery room, where you will have your heart rate, breathing, oxygen, and temperature measured by a nurse. Blood pressure readings will be periodically measured until you leave the recovery room. Depending on the type of procedure you had, you may still have a breathing tube, or you may have had your breathing tube removed before leaving theater. Your family is able to reunite with you at this time. Family members are not allowed in theater due to sterile policy. Here you will be given a popsicle, some water, or a snack. The nursing staff will go over post-op instructions on how to care for your mouth once you proceed home from the hospital. Once your vital signs are stable and you can stay awake, you can leave the hospital.